Good morning, everyone. I am going to give folks a couple more minutes to get logged on here. So we'll shoot for 11:01, 11:02 start time.
Is there an option to record these meetings?
Yes, the WebEx will be recorded and sent out afterwards. So if you don't get it, just please reach out to me and I can make sure that you get it.
Thank you.
All right, good morning, everyone. Thank you for joining us for today's media availability. My name is Claire Paprocki and I'm with Brown County Public Health. And we are pleased to welcome you to share information and answer your questions about today's announcement. As we shared in our news release earlier today, Bellin Health, the Green Bay Packers, and Brown County Public Health will be joining forces to offer a community COVID-19 vaccination site at Lambeau Field. This site will serve to those who are currently eligible for vaccination in accordance with prioritization laid out by the Wisconsin Department of Health Services. We plan to launch the site Wednesday, March 17th. This is a true team effort to meet a critical community health need, and we look forward to working together to equitably vaccinate individuals in our area. To talk further about this effort and answer your questions, it's my pleasure to introduce Bellin President and CEO Chris Walesky, Green Bay Packers President and CEO Mark Murphy, and Brown County Public Health Officer Anna Destree. Up first is Chris Walesky. So Chris, I'll turn it over to you.
Thank you, Claire. Hello, and thank you everyone for joining us today. This is an exciting day, one that we have been looking forward to. Mark and I were just talking about how excited we are to be here today to talk about bringing Lambeau Field into this space to help with vaccinating. So we're very grateful for the partnership that we have with the Packers and with public health. We could not do this without this concerted effort of everyone who's on this call. As you know, this vaccination site is going to be a critical part of our effort to get the pandemic under control and to get us back to some semblance of normalcy. So that in and of itself is very exciting. You know, Lambeau, simply put, it's a perfect place for this. It's ideal. It's very visible, it's very well known, and it's accessible. And the crew there is second to none in terms of their ability to get large groups of people in and out with ease. So we're really happy about how this is all taking shape. The clinic is initially going to operate in the atrium, and it may expand to other areas of the stadium as weather permits and as our numbers grow. So with adequate supply, we would be able to vaccinate about 6,000 people per week when we start, and we will ramp up to 10,000 per week. So large numbers of individuals will be able to get on the path to getting this pandemic behind us. So how is it going to work? I just want to give you a couple of key points. First, this site is for anyone who meets the eligibility requirements. You don't have to be a Bellin patient. If you meet the eligibility requirements, that's all that we ask about. We do want you to have an appointment, however. So this site is not going to be, like no tailgating before the vaccine, no standing outside in line and hoping to get a vaccine. You have to have an appointment. That's really important. We will not have the capacity to accommodate walk-ins. With respect to who gets the appointments, it really is based upon the eligibility criteria that is set by the state of Wisconsin. And as we heard yesterday, this will include individuals with certain medical conditions starting on March 29th. So for right now, we are still in the 1B population. So we're vaccinating the 65 and older population, really focused on them, as well as focusing on educators. On March 29th, we'll have more information that will come out later about how you go about getting on the list for that. But for now, so that we don't overwhelm our phone-in system or our IT systems, we just ask that you stick to the eligibility criteria that's set for right now. If you are eligible, you're able to call our COVID-19 hotline, which is 920-445-7313. And with that number, you'd be added to an appointment waiting list. We'll get back to you and get you scheduled. When the site opens, we will sunset our existing vaccination clinic that we host at our Ashwaubenon Clinic campus. So starting March 17th, all of the vaccinations will occur right in the Lambeau Field atrium. Again, couldn't be more convenient. And of course, it doesn't get much better than being able to say that you had your vaccine at the most iconic stadium in the NFL. So as we prepare to ramp up our rollout at Lambeau, we're working to ensure that everyone in our community has equitable access. That's very important to us, and the state has also gone on record saying how important equity is to them in making sure that we roll this vaccine out in an equitable fashion. So in just a moment, Anna Destry is going to share some key information surrounding transportation and health equity considerations as they relate to this effort. So this is a true team effort, as I've said, and we can't thank the Packers and public health enough for working with us to vaccinate our community. To talk more about that partnership and where we're going, I'd like to welcome a guy who knows a little something about teamwork and the power of teamwork, Packers President and CEO, Mark Murphy.
Figured I should figure out how to unmute myself sooner than that, but as much time as we all spend on Zoom and webinars. Thank you, Chris, and I really appreciate your kind comments, and thank you to everybody for joining us today. First of all, I want to thank Bellin Health as well as Brown County Public Health for all their help over this past year. Obviously, their expertise and leadership. Not only have they been great to work with in terms of this process of setting up the vaccination site, but really throughout the whole year in terms of taking care of our community. But also, we had regular calls with them as we got through the season. I was very proud of the way the Packers organization handled the pandemic, and a big part of that was, Bellin Health and as well as Anna Destry, particularly from the Brown County Health. And we were able to host fans at the end of the season, and wouldn't have been able to do that without their help. In particular, obviously, Chris has been so helpful just to be able to bounce thoughts off of her. Dr. Michael Landrum, the infectious disease expert at at Bellin Health was invaluable, and Anna, who you'll hear from later, was really valuable as well. You know, it's been a challenging year for all of us. You know, looking at my calendar, it's exactly a year to a date, to the day, last March 12th, you know, we closed public operations here at Lambeau Field when the pandemic really hit us. And I tell you, we couldn't be more proud a full year later now to be moving forward with providing Lambeau Field as a site and helping to assure equitable access to the vaccine. We all want this to end as soon as possible for so many different reasons. Many of us want to be able to hug our children, our grandchildren, feel safe working and going about our normal everyday lives. And obviously, from a selfish standpoint, we want to see Lambeau Field packed with fans. And getting vaccinated is a key part of that effort. You know, I'm 65, and as a result, I was eligible for the vaccine. By the way, I should say I've never been happier to be 65. And I got vaccinated as soon as I could. I know fans often question decisions that I make, but I don't think anybody can question this decision. To get the vaccine, you know, it's good. It's not, and I have to tell you, it gives you hope, and it's a relief. And not only is it good for you to get the vaccine, it's good for everybody, for the common good. And I would encourage everybody to take the vaccine as soon as you're eligible. We know it's safe, it's effective, and incredibly important. Much like the Packers, our community is a team, and we can't win against COVID until all of us, everybody gets a shot to ensure all of us are protected. You know, in the meantime, we have to continue with the masking, social distancing, washing your hands. You know, we want to enjoy Packers games in person with our fans again. And really, the only way to do that is to get a significant portion of our community vaccinated. We don't have the supply to do that yet, but we will, and we will be ready. I have great confidence in both Bellin Health and Brown County Health, and we can ramp things up, as Chris said. As we get ready to launch next Wednesday, we are really proud to be able to add Lambeau Field to more than a dozen now NFL facilities, stadiums are being used as vaccination sites. We're also looking forward to using our platform to help promote the need to get vaccinated and to amplify the message to all of our fans. We're also dedicated, we're going to do everything we can. We're going to work as closely as possible with Bellin Health as well as Brown County Public Health with all their efforts to ensure equitable access to the vaccine for everybody in our community. And, you know, to talk, and I mentioned her a couple times, she has just done an outstanding job for this community and working with us and talk a little bit more about that effort and how we're going to ensure everybody who wants to get vaccinated eventually can. It's my pleasure to welcome Brown County Public Health Officer Anna Destry. Anna?
Well, thank you, Mark. Those are very kind words. And thanks again to all for being here today. For the past year, COVID-19 has challenged our communities, our businesses, and our families in ways that are too numerous to count. And while we still have a long way to go to get back to normal, this vaccine provides us tremendous hope for the future. We understand and take to heart the need to place equitable distribution at the core of our plans to open the Lambeau Field site. We have an extensive framework for doing so, and I would like to briefly touch on just a few of those elements as part of our discussion today. Engaging community partners is critical. In addition to the entities represented here today, some of our other partners include the YWCA, ADRC, Curative Connections, Casa Alba, the Brown County Library, Brown County United Way and 211, New Community Clinic, the Green Bay Police Department, COMSA, Prevea Health, and the local school districts. We are all in this together. Bellin and Brown County Public Health are working to address issues surrounding health equity, such as registration, language, transportation, and technological barriers. We are continuously listening to and learning from our residents to understand the reasons why people may not want to get the vaccine and how to help boost vaccine confidence. Our goal is to build trust and confidence with marginalized populations, as well as battling misinformation in the public and on social media. Our partnership is key to this effort. We also know that it will be important to reach out to those who may need more information about the vaccine to help them make an informed choice when they become eligible to receive it. And we're not alone in this. This is a true partnership, and not just between the three entities represented here today. From other health systems to pharmacy partners and public health departments, all vaccinators have the same goal: safely and efficiently getting shots in arms of all those who are eligible. Because every vaccine that is given gets us that much closer to our goal of an eventual return to normalcy. Every vaccine that is given has the potential to save lives. We look forward to continuing to leverage the power of this partnership to educate and vaccinate the public. Thank you.
Thank you, Anna, and thank you, Mark and Chris. I will now open it up for questions. If you could just state the media outlet you're reporting from and who the question is directed towards, we'd be happy to answer the questions you have.
Hi, Rob Sussman from WTAQ. My question is one of vaccine supply. Do you have the adequate vaccine supply to get the Lambeau Field site up and running to a fairly decent capacity quickly?
Yes, our supply has actually increased, and we are working with the Department of Health on making sure that they know what our capacity is at Lambeau and how quickly we can ramp that up, and they are engaging with us and working collaboratively to help us to maximize that location. So we feel pretty confident about it. We delayed opening because we weren't confident, and we wanted to wait till we knew that we had enough of the vaccine. And when J&J was approved and came online, that brought a lot of extra capacity just across the state in general, and so we're going to be using that.
I'm not sure who would answer the question. This is Kia with Fox 11. How long do you think this clinic will be set up, especially when the hope is that there's going to be enough vaccinations to vaccinate the general public by the end of May?
So my understanding of the end of May is that there will be an opening up so that everyone would be able to, would be eligible for a vaccine. But I think that we will have to keep the clinics open for quite some time to actually be able to vaccinate that number of people. For example, just in the new 1C group that they just announced yesterday, there's about 2 million people in that group. At 10,000 a week at our location, and if you took all of the locations around the state, it's still going to take a while to get all of the population who wants the vaccine through this process. And when remember, many of these also require a second dose. So you're doing your first dose, and then 3 weeks later-ish, 3 or 4 weeks later, you're doing the second dose. So it's going to be a bit.
And when you say a while or a bit, is that through the end of the year? Is that into next year?
You know, it's dependent upon so many factors, Kia. I don't know that we can really tell you an exact timeline because it depends upon the public. And I appreciate Mark's encouragement for people to get the vaccine when they are eligible. But the pace at which we can vaccinate is dependent upon many different things, the supply being one of them, which was one of the questions, but also upon the public and their ability to get those appointments scheduled and to commit to getting the vaccine, which we really hope happens.
Thank you.
Hi there, Ben Jordan here with TMJ4 News in Milwaukee. Curious who this is open to. Is it just for people in Brown County? Is it anyone in the state who would be eligible at any given time?
It's anyone in the state. However, our focus and our effort is going to be in this region, and our hope is that we can really make it an access point for this region. But the state has indicated that anyone who seeks an appointment at the location would be eligible if they meet the criteria.
Rich Ryman with the Press Gazette. To be clear, which vaccine are you going to be using?
So we'll likely be using all 3 vaccines. We currently have both Pfizer and Moderna that we have been offering. And hot off the press, we just learned this morning from DHS that we will be getting some of the J&J vaccines next week.
Will people be allowed to pick which vaccine they get? Are you concerned at all that they may want to shy away from the J&J vaccine because it's presumably lower efficacy?
You know, I think there are trade-offs. It's one shot. So for some people, that's a big deal. And it has been shown to be as effective at preventing serious illness and hospitalizations and death. So I don't know that people will choose one over another based upon the efficacy. It's not a very significant difference when you talk to the medical professionals. As far as will they be able to choose, the logistics of that are very difficult. And I can't commit to you now that we will be able to rely on a particular vaccine supply enough to be able to say that we can commit, you can choose which one. My advice would be when you're eligible, take the vaccine that you can get. They're all good.
Mark, question for you. Is the atrium going to stay open during this period, the 1919, the Hall of Fame, and the tours such as you are able to do them now?
Yeah, yes, Rich, they'll stay open. Everything's set up and cordoned off. So, and Chris, I think also as we ramp up, we have plans where we could expand, take on additional people, and using other parts of the stadium. You know, the other thing I wanted to mention, I know a lot of people are concerned about side effects from the vaccine. I had both shots of the Pfizer vaccine and had no symptoms, no side effects at all.
In terms of opening up past the atrium, would you be able to share where exactly? Could it go as far as, being closer to the field?
I think I'd prefer not to get into it, but it wouldn't be on the field, but it'd be other parts of the stadium undercover.
Any more questions for Mark, Anna, or Chris? Great.
Well, this could be for anyone who wants to answer, but it's been a long year for all of us, not only here in Wisconsin, but just in the country, in the world. For you guys personally, how difficult has this year been? Has COVID been on your life, your jobs? And then given that, what does it mean to be at this point where we're all getting on board with helping provide the vaccine and access to it on this level?
Anna, well, I think, Anna, you should answer this one. You've probably been doing, well, we can all answer, but you start.
Sure. It has been a year. It's been not just for myself, but for staff and our family members. And, we too, even though we are working on the front lines throughout this pandemic, we too had family who were in school, and, all those things still were relatable to us. So I would say it's been a long year. I think the silver lining now is we're here today talking about what is close to the end. We have these excellent partnerships that have been formed over this year or made stronger over this year. and we're just getting so close. So I think it's been a long year, but we're almost there. And I will say there's a lot of excitement around that.
Yeah, I mean, to use a football term, we're in the red zone. So I know, and you know, I mentioned it in my comments. It was just such a good feeling to get the vaccine, and I would just anybody out there hesitating or thinking about whether or not I should get it, it's such a good feeling. It gives us all hope, and yeah, it's just if we can get to the point where everybody that wants to get vaccinated has been vaccinated, it's just one big step towards getting back to normal lives and being able to do all the everyday things that we took for granted. And it's been a long year. I think I figured it out. I was tested every day for 200 straight days, and those are the things that we had to do to coexist and continue to do our play during the season, and and everybody else is making the same sacrifices in their business. So, and look at the economic impact this has had on so many, particularly smaller businesses, and so this is it's the best thing for all of us. And again, as I mentioned, the common good.
Every day for 200 days, have your sinuses developed calluses? My goodness.
Yeah,
One of the worst days was when I tested positive. And unfortunately, it turned out to be a false positive, but that was not a fun day. But no, it's that was and everybody in the organization and in the football side of it, players. I mean, that was the sacrifice that we all made, and as I said before, I was very proud of the way not only the Packers, the entire league, to be able to get a whole season in without any games being canceled was pretty remarkable.
Yeah, I would say the year for me, just incredible pride in this region and how we hung together. If you looked around the state and around the nation, the number of public health officers that left their jobs in the midst of this, it's a significant number. And Anna hung in there. And so kudos to Anna and the public health team for sticking with us through this. This has been, something that none of us have ever faced before. So really proud of that, really proud of the business community here. They've been particularly hard hit, as Mark has said, and we need to be there for them and help them. And the sooner we all get vaccinated, the sooner we can, eat out and go to events and support our business community like we never have before, and look for opportunities to shop locally, and lots of conversations about that. So really proud of this region and how we have gone through this together, and how the healthcare organizations have come together and worked collaboratively has been just fantastic. And yes, to Anna's point and to Mark's point, there's also personal sacrifice, of course. We are the same as everybody else. And so I end all of my calls with my team with the Korean phrase, kachi kapshida, and it means we go together. And I'm proud that we all went together.
Aside from the historic nature of Lambeau Field and the sheer size of the stadium, what makes this an ideal location for a mass vaccination site? Is it the parking lot? Is it the centralized location in downtown Green Bay? What is it?
I think you're answering your own question, Ben. It's all of those things. It's everybody knows.
Yes.
Yes. Everybody knows where Lambeau is. So we don't have to worry about addresses, and their parking is great because they use the number system, and you can tell people which parking lot to go to, and lots of people are very accustomed to that. That makes it easy. The concierge crew within Lambeau is fantastic, and they make it easy. We have a saying in healthcare, no wrong door. And it's sort of like that at Lambeau, no wrong door. Somebody's going to be there to help you. And it's a great location because of all of those things. And of course, its sheer size and ability to accommodate 10,000 people a week going through there and getting vaccinated and having their place to be observed after their vaccination and all of that. Well, it's a combined effort from Anna's team and Bellin Health. We have hired on additional vaccinators. One of the things, again, I mentioned how proud I am, just really proud of the Bellin Health team and their commitment to getting all of us through this pandemic. The number of additional shifts and hours they've taken. People have learned new jobs and new skills. They're excited about working with the Packers and with public health and bringing this to the community. And frankly, it energizes them and they're going to rise to the challenge, and that's how it's going to get done. Anna, can you answer the question on the hours?
Yeah, so it's going to be open 7 days a week. The hours, I believe, are 7 to 7 Monday through Friday, and 8 to 4:30 Saturday and Sunday.
Any final questions for Anna, Mark, or Chris?
Will the Packers light off fireworks after every vaccination that's been administered?
That's a very good question. It's something we hadn't thought about.
I wonder why.
Maybe when we get to herd immunity, we could.
There we go.
We might have to celebrate some milestones, though. I'm thinking flyovers and fireworks are appropriate for the stadium. Yeah.
I like the way you're thinking.
It's important to have a little fun.
Any last questions for Mark, Chris, or Anna today? All right, thank you everyone for joining us today. For those who are wanting B-roll or shots, I will be at the stadium from 2 to 3 p.m. today. So if you enter through the American Family Insurance gate, you'll see me standing close to the guest services desk, and I'll be happy to help you. So thank you for joining again today. Thank you to Mark, Chris, and Anna, and have a great weekend.